Now, what are the components of the granulation tissue? Let's talk about it. Granulation tissue. So, first of all, what is granulation tissue? What is a wound? We'll talk about it in a great detail, because as a nurse, managing the wound is one of the major activities, right? So you must be knowing pathophysiology, what is the nursing management, and also how are you going to, what are the things you need to be very sure when you are handling a wound, especially with such a widely prevalent disease like diabetes. Wounds are a very common finding. Now, all of them, angiogenesis, fibroblasts, chronic inflammatory cells, all of them will be the components of the granulation tissue. Now, what is a wound? Wound is a breach. Breach means breakdown in the body surface leading to the disruption of the tissue. Now, if you look at our skin, yeah, I'll try to move that side. Now, you have, what are the layers of our skin? You have epidermis, after that you have a dermis, under that you have a subcutaneous tissue and the connective tissue, finally muscle. So these are the various layers of our skin. Okay. Now, suppose if only epidermis is injured, if there is a breach in that, you call superficial wound. Then, if the dermis and epidermis, if there is a breach, you call partial thickness, yes. If there is a involvement of epidermis, dermis and subcutaneous, everything, that you call full thickness, right? Now, what is the healing? Healing is the response to the injury to restore the normal structure and the function. That's called healing. Now, if you take our cells, there are three kinds of cells that are there in our body, which you have to be very sure about. Labile cells, stable cells, permanent cells. What do you mean by labile? Labile means every day they keep on multiplying. They are continuously replicating. That is called labile. So, bone marrow, skin, they are examples of labile cells. Then you have stable. Stable means they don't regularly multiply, but if requirement is there, they will multiply. Permanent. Permanent are the nervous tissue. Nervous tissue, permanent. That is, after birth, it won't multiply at all, is the permanent cell, is what you have to remember. So now, if you look at the repair, what are the various stages of repair? First, the moment there is any wound, injury, hemostasis, bleeding should be stopped. For that, there is a fibrin clot, platelet deposition, platelets come, hemostasis होता है. बाद में इन्फ्लेमेशन होता है, इसलिए हमको जब भी वुंड होता है पेन क्यों लगता है? इन्फ्लेमेशन के वजह से. So the WBCs, macrophages, lymphocytes, they all will come to that place. Then you get proliferation. New blood vessels will grow there. Epithelium regrows, and that is called proliferation. Finally, remodeling. Once more, skin, the skin on the thumb, the skin on the back of the palm. There are different kinds of skin, no? So when the wound is healing, same type of skin should come. So remodeling hota hai. So if you look at the granulation tissue, there is a phase of inflammation, phase of clearance, and phase of ingrowth of granulation tissue. So when the granulation tissue forms, there is angiogenesis. Angio का मतलब है blood vessel. Angio का मतलब है blood vessel, right? Angiogenesis and fibrogenesis. These are the two things you need to remember. when there is a granulation. So this is called angiogenesis. So you can see here that this is the vessel, capillaries are growing, and a mature network of capillaries has formed. This is the angiogenesis that happens whenever the wound is healing, is what you should remember. So there is a growth factor which is called vascular endothelial growth factor. Vascular endothelium को ग्रो करने वाला फैक्टर होता है, ये आके स्टिमुलेट करेगा neovascularization को. Similarly, there is a growth factors which are coming from the platelets. Platelets are also, platelet means we will only think it is meant for the purpose of clot formation, but platelet is like an atom bomb, sister. Remember, it contains a lot of chemical mediators. One of them is the platelet derived growth factor. It will also help for the wound to heal. Then there is a TGF alpha that is called tissue growth factor, tumor growth factor alpha, it is called as. These are the various growth factors which are produced. Then there are a type of cells called as fibroblasts. आपको BCG का टीका लगाए ना, टीका लगाने के बाद बचपन में you get a scar, BCG scar. So what do you have? What is forming that scar? It is the fibroblasts which are forming the scar over there. And by 6th day, remember this is a favorite question of the examiner, by what day collagen comes and deposits is a very, very important question. By 6th day, the collagen comes and deposits is what you have to basically remember. Then the wound, after it got healed, it will start contracting. So contraction of the wound starts within 2 to 3 days. By 14th day it is over, and by the 14th day, wound becomes reduced to almost 80% of its original size. So this is how the wound healing process occurs. So you will see a lot of diabetic patients who are having wounds. You also see paralysis patients who are bedridden for a long period of time, they develop bed sores. Bed sores. They are also wounds. So if you know what is all happening inside, you become more knowledgeable to treat the patients tomorrow, right? So that is the reason. So two types of healing occur in a wound. One is called healing by primary intention. Second is called healing by secondary intention, which you have to be very sure about. So healing by primary intention, इसका मतलब क्या होता है? Typically a clean wound, a wound which is not infected, or a wound that we make at the time of surgery, surgically incised wound, where the tissue loss, cell loss is not too much, and there the edges of the wound, they become approximated if you put a surgical suture लगाने से. So you have a wound, this is one edge, other edge, here you have put a surgical suture. That kind of a healing is called healing by primary intention, is what you have to basically remember. So you can see here the whole story. Immediately after the injury, the wound is filled with blood which clots and seals this wound. You know, this is the wound margins. Into that the bleeding occurs and it will seal it. Then there is an acute inflammatory response which occurs within about 24 hours. Inflammatory cells. Inflammation. Inflammation का मतलब क्या होता है? आपका white blood cells वो सब रहता है ना, sister. So they all will come there. It occurs within 24 hours. White blood cells को बोलते हैं polymorphs. They typically appear, neutrophils, etc. And by 3rd day, the neutrophils are replaced by macrophages. So this is the acute inflammatory response. Then after that, epithelialization occurs. Epithelium will grow. Epithelium will start growing, right, to fill the gap. By 5th day, there will be a newly formed epidermis. that you typically see. Then typically the fibroblasts come, they put the collagen and the scar tissue form, and in about 4 weeks you will find the presence of the scar tissue organization occur. And this is how the healing by primary intention, where you can be able to apply the sutures and it is a clean wound. Then what is meant by healing by secondary intention? A large tissue defect hai samjho. It is not a fine one, large tissue defect. Extensive loss of cells is there. And you can't be able to put a suture and approximate the margins. And the healing will take, typically if this is the wound, from the base upwards and from the margin inwards. That's how it takes, and a large scar will form. So you can see classically this is the wound, the platelets, RBCs, everything, but there's a big gap. Fibrin comes and deposits there. Initially there is a hemorrhage where the blood fills this clotted area, right? Then later on there is a inflammation, early and late inflammation. There is the inflammatory phase where macrophages come and clear the debris, right? Then epithelial changes occur, and what is formed? Granulation tissue is formed. That is what examiner is trying to ask. So when you are doing ward rounds, what is a surgeon looking for? What is a nurse looking for? We look whether wound is healing or not. How do you know wound is healing or not? You look whether granulation tissue is forming or not. So granulation tissue formation is a sign that the wound is healing, is what you will be able to understand. Finally, wound contracts to 1/3 to 1/4 of its size, and a collagen scar will form, is what you have to remember. So let us quickly summarize that Ranjit Shah is asking, sir, I need your help. I want to attend your quiz classes on MBBS subjects, and later on when I will be in 4th year, I will pay for your subscription. You should remember one thing. I had been teaching students almost 2 decades. Never we did this for money. Money automatically students pay the fee. We never asked them, they pay the fee. That's not a big deal. So no worries at all. No worries at all, Ranjit. So, and even Rojo also, I want to tell that you top the staff nurse recruitment exam and come and say that I joined today in AIIMS. That is the happiest day for me, any given day, right? So no worries at all. Now, primary is a clean, secondary healing by secondary intention is not clean. Margins are surgically clean, whereas they are irregular in secondary. Sutures are used in primary, healing by primary intention. Granulation tissue is very little in case of the primary, and it is a linear scar. And complications are not that frequent. So this is the primary and secondary intention. Now what are the complications of the wounds? The wound healing. Infection, pigmentation can occur, and a scar will form that is very weak, and that can lead to the contents to come out. Typically after you do hysterectomy, cesarean or any surgery, if the abdominal wall while healing, if the scar is weak, that can lead to development of hernia. Hernia means protrusion of the abdominal contents out, is called hernia. So herniation can occur. So these are all the issues. So what you are seeing here is at the time of healing, some people, there can be a hypertrophied scar, a scar which is looking ugly, hypertrophied scar, or there can be a keloid like this, which can form when the wound is healing. The scar can lead to the formation of the keloid. But the main difference is If this is the wound, a hypertrophied scar is confined to the margins of that wound. Whereas keloid expands everywhere. It overgrows the margins. That is the keloid tumor is what you have to basically remember. There can be excessive contraction, especially burns की वजह से होने वाले wounds. They can lead to development of contractures. Contracture means that excessive fibrosis will make the contracture to develop, and there can be development of cancer from that scar tissue. A squamous cell carcinoma can develop. That is called a Morgellons ulcer. What is the name given for that? If a cancer develops from a wound which has healed, it's called Morgellons ulcer, is what you have to basically remember. Now comes a very, very important question that all of you should be very sure about. What are the factors that affect the wound healing? The main factors that affect the wound healing are oxygenation. If oxygenation is good, healing is better. इसलिए we use what is called as hyperbaric oxygen therapy. Hyperbaric means with high pressure you apply oxygen in order to improve the healing of a diabetic wound. Hyperbaric oxygen therapy is used. So oxygen, infection will prevent the healing. Any foreign body wound के अंदर है तो it will prevent healing. Similarly, venous insufficiency. A lot of patients with varicose veins we see every day in the hospital. Varicose veins, right? So varicose veins. So when varicose veins are there, there is development of ulcers. Ulcers typically along the medial surface of the leg. So they also will be little slow in healing. How many days will take to heal a fasciotomy wound, sir? Excellent question, Roja. So typically any wound takes about 6 weeks. 1.5 months is the typical time. By the time collagen comes, contraction of the wound occur, etc., happen. Similarly, the age, the gender, male or female, sex hormones, stress, ischemia, diseases like diabetes, keloids, jaundice, uremia, even renal failure patients may, when there are wounds, healing will be delayed. Obesity will delay the wound healing. If the patient is on steroid therapy or chemotherapy, the wound healing become delayed. Alcoholism, smoking, immunocompromised conditions like cancer, radiation therapy, they all will slow down the healing is what you have to basically remember. Now, oxygenation, very important. Hypoxia. Hypoxia is the one, oxygen should be sufficiently provided. So, hyperbaric oxygen therapy is the one which is used. So, this is a diabetic patient and you have given a hyperbaric oxygen therapy. Hyperbaric oxygen therapy, and after 50 completed hyperbaric oxygen therapy sessions, the diabetic ulcer healed very well. That is what you have to remember. Similarly, infections. The skin which is injured, microorganisms will get an access and they will delay.